Today I want to share with you a simple device that we all have that could improve not only your health, but the health of the world. By the end of my time with you, you're going to say, this is amazing. Why didn't we think about it? And let's get started. I want to review 3 concepts that are making this possible. The first is the fact that we are spending an enormous amount of our healthcare dollars, but not spending enough on prevention. The second is also the fact that we're looking online already for health information. And finally, the third is that we have models that we can use that show us that, yes, leveraging the technology in our cell phone can help improve our health. So let's get started. Money. In the US, we are spending over $3.3 trillion a year on healthcare spending. What does that mean to you? Well, what about if I gave you $10,000 a year? Each one of you in this room. Because you know what? That's about the equivalent of what $3.3 trillion is. If I gave you $10,000 a year, I would ask you, well, how do you want to spend it? How many of you would you say buy a new car, pay off your credit card bills? Yeah? You would want to use that money wisely. But what is happening really with our healthcare dollars in the US? 88% is being used to treat chronic disease. A lot of these diseases could have been easily prevented and even managed with public health interventions. Are we using this money wisely? What can we do? How can we turn this around without increasing our spending on healthcare dollars? And the answer I want to give you is leveraging the technology in our cell phones. And you may say, well, how can that be? The technology in our cell phones? Yes. Did you know that the computing power in your cell phone is just as much, if not more, than what NASA used to go to the moon in the 1960s? That's incredible. So the power is there for us to be able to leverage this information. All right? So many of you may say, well, okay, that sounds great, but in reality, is this realistic? And the answer is yes, because 95% of all Americans already own some type of cell phone. 95%. And for the other 5% that don't, I would probably say you live with somebody that owns a cell phone of some sort, right? 77% of all of those who have a cell phone have a smartphone. So what does that mean? That means they can access the internet, they can access access so much more. It's there. The beauty of this is that this holds true for all socioeconomic levels and ethnicities. We have healthcare disparities, some of which we already know of, and we know that we have a higher obesity rate among lower socioeconomic status. We also have a higher diabetes rate among Latino population. We have a high unplanned pregnancy, among all of women of color. So this is an opportunity to have a health equalizer in the palm of our hands. And we all have it. So let me go on to the next point. The next point I want to share with you is the fact that we already have, is with the story actually, of a patient that I took care of recently. Her name is LaTanya, and LaTanya was a 16-year-old African-American girl, pregnant with an unplanned pregnancy, and she was about 6 months pregnant when I saw her. LaTanya later shared with me that she looked online to find out what was happening to her because she was having cramping and bleeding. She said, I was scared. I didn't know what to do, and I didn't have prenatal care. I didn't know who to turn to, but I looked online and I found out what was happening. It said I could be going into labor and I needed to come to the hospital. When I saw LaTanya, she delivered her baby shortly after arriving, and the baby weighed 2.5 pounds, and the baby stayed in the hospital for about 3 months. The baby later on went on to have visual as well as developmental problems, lifelong problems. The point I'm trying to make with this story is that we are already accessing health information on our cell phones. I want to share with you the fact that we need to change the paradigm of how we're using this information. Why not go on our cell phones and look for tips that are going to help us be healthier? Look for ways that we can stay healthy. We all go on social media, we all go online and we search for information, and what do we get? A pop-up ad, right? Buy this, based upon what you've been searching, based upon who your friends are on social media. Why can't we get a pop-up ad that is reminding us about healthy tips? To leverage our Instagram account, our photo accounts, whatever it is, to be able to promote health. That would be wonderful, to help prevent disease. What a novel concept, right? So what about disparities? Well, by leveraging the fact that we have videos online, we can actually post videos that help promote health in whatever language we want, whether it's English, Spanish, Mandarin, whatever language it is that you choose. We can educate and give informational, proactive health ideas. A picture is worth 1,000 words, right? So we can surpass this literacy level that perhaps people don't understand the written words, but everyone, most everyone, can understand a video. Let's leverage that information. Now for your teen, for those of you who have teens or are younger, if you're looking online and you're searching for college information, or maybe looking for that prom dress or suit or getting ready for the prom, what about if you got an ad that popped up that said, have you started to plan for your reproductive life? Do you have a reproductive life plan? And then goes on to explain what a reproductive life plan is, to help empower a decision as to when they want to have a family, if they want to have a family, and what they need to do in order to make that possible. Perhaps LaTanya's outcome would have been completely different. This is all free for us to be able to access, and really the cost is minimal to produce. The next concept I want to highlight is the fact that we don't need to reinvent the wheel in order to come up with these programs that leverage the cell phone technology. What we need to do is to look at the models that work and make it better, and more importantly, make them proactive. You know, my husband recently purchased a cell phone, and the cell phone, for those of you who have not bought one recently, comes pre-programmed with text message alerts from the government, right? One of them is the Amber Alert. So when there's a child missing, we get notified, and the other are the emergency alerts. So some examples that go on there are weather alerts. Shortly after having bought the phone, he got an emergency alert about a flash flood, lots of rain happening. The alert informed him on not only where this was happening, but how long it was happening for. Wouldn't it be wonderful, simple, if we got public health text message alerts, right? To tell us there is a Zika outbreak in your area, or there is an influenza or measles outbreak in your area, and this is what you have to do, this is where you need to go to get information. Click here. But we're not doing that. We're being very reactive. But we need to be more proactive and help prevent disease. Now, it seems simple enough, right? Text messaging. But you may say, really? Can we text message? Oh, yes, we can. Because 97% of all of Americans are text messaging at least once a day. The range can be from over 128 text messages a day to about 16 text messages a day, depending upon your age. If you're over 55, you're averaging 16. Yeah, I get text messages from my mom. And your teens are text messaging about 128 plus times a day. The point is that we are already doing this, right? We are already communicating, and going back to the disparities, of all the ethnicities that are doing text messaging, Hispanics are doing the most, followed by African American. So talking about an opportunity to help equalize health, to help lay that playing field and address the disparities, let's leverage our text messaging. We have programs that show that people can stop smoking, people can be reminded to take their medications for their blood pressure, and also programs that help mom lose weight after having a baby. And the one thing I want to highlight is I had a patient, her name is Lorena, 22 years old, and Lorena had a healthy baby girl who I was rounding on in the hospital the day after delivery. I was at Lorena's bedside, and I looked at the baby, beautiful baby, great delivery, and I asked Lorena, are there any questions that I can answer? And she asked me the almost universal question that every mom has. When can I lose weight, right? Lorena's case, you have to realize, is that she's 5 foot, and she was weighing 200 pounds by the time she delivered her baby. It's not an uncommon story. She started out obese, and she gained a little bit more weight than what she should have. Lorena used a text messaging program that was supplemented with online information that helped her get back to her pre-pregnancy weight. She had work to do, but she got back to that. She said, you know, I felt motivated and I felt supported by getting those text messages and getting that information. The point is, we have the resources available. We have the models that already exist. So let's duplicate these models. So I hope I've now inspired you, and you are now thinking, let's do this, let's get started. Let's leverage the technology in our cell phones to really improve our health outcomes. We don't need to buy anything new because we already have them, right? We have them in our hands. We have the models to replicate because we know that they work. The evidence is there that the outcomes are working. So come with me and take the step to really change the way that we are using our healthcare dollars, and more importantly, address healthcare disparities and improve the health of America and generations to come. Thank you.